Hey everyone, and welcome to this explainer on the 2025 AADA Standards of Care. Today we're diving straight into some pretty dense clinical guidelines to figure out how they actually translate into an empowering, actionable playbook for your health. Whether you're living with diabetes, supporting someone who is, or maybe you're a clinician looking for a structured breakdown, this explainer is designed to give you absolute clarity. Let's get right into it.
So, how exactly do you protect your body from a condition that affects it literally from head to toe? It's a massive question, right? Because while diabetes is undeniably a whole body condition, the most severe complications are actually largely preventable. And the real secret here? Early detection. We aren't just waiting around to treat symptoms, we're actively protecting your body's systems before the damage even occurs. Here's our roadmap for today. We'll start with a whole body impact, move on to retinopathy and protecting your eyes, tackle neuropathy and nerves, discuss foot care to prevent ulcers, and then we'll wrap the whole shebang up in the proactive playbook. Section 1, the whole body impacts. You know, the ultimate shield against severe complications isn't just sitting in a pharmacy somewhere, it's actually found in our daily habits combined with clinical support. The ADA data is super clear on this. Intensive diabetes management, meaning keeping your blood sugar, blood pressure, and lipids in check, can prevent or dramatically delay the onset of complications. These guidelines aren't just a warning, they're a literal roadmap for preserving your quality of life. Section 2, retinopathy, protecting your eyes. To really understand diabetic retinopathy, think of the retina at the back of your eye, kind of like the film in a vintage camera. If the tiny blood vessels supplying that film are damaged by chronic high blood sugar, the picture becomes compromised. Now, because this can be entirely asymptomatic in its early stages, getting a prompt diagnosis through screening is absolutely critical to saving your sight. Check out this timeline contrast because it's incredibly important. If you have type 1 diabetes, the guidelines recommend your initial comprehensive eye exam within 5 years of onset, simply because retinopathy takes a while to develop. But look at type 2 diabetes. Screening needs to happen immediately upon diagnosis. Why? Because type 2 can go undiagnosed for years, which means significant eye disease could already be present the very day you find out you have it. Now, there is some really great news built into these clinical standards. If your eyes are healthy, there's no evidence of retinopathy, and your blood sugar is well managed, your screening interval can actually safely shift from every single year to every 1 to 2 years. It's like a direct reward for proactive management. And get this, the 2025 standards are now officially recognizing FDA-approved artificial intelligence platforms for screening. That's right, we basically have robotic eye doctors. Systems like AIEDS, iArt, and Luminetics Core are using retinal photography and AI algorithms to detect retinopathy. This tech is an absolute game changer, making sight-saving screenings way more accessible, especially if you don't have an eye care professional right down the street. But what if an issue actually is detected? Well, we are far from powerless. We have some incredible modern tools to prevent vision loss. Anti-VEGF injections, which basically stop abnormal blood vessels from growing, are a first-line treatment for swelling in the eye, called macular edema. And the amazing thing is these treatments can actually help reverse the disease. They aren't just a last resort. Alongside precision laser therapies, modern ophthalmology can totally protect and even restore visual function. Section 3, neuropathy, nerves and pain. Imagine your body's internal electrical wiring just slowly fraying over time due to high blood sugar. That's diabetic peripheral neuropathy, or DPN. When these peripheral nerves get damaged, the signals get totally scrambled. You might feel burning pain or tingling, but honestly, what's even more concerning is that it can lead to a complete and total lack of feeling in your extremities. So why is this a massive deal? Up to 50% of diabetic peripheral neuropathy cases can be completely asymptomatic. Literally, no symptoms at all. You could have severe nerve damage and be losing the protective sensation in your feet without feeling a thing. This hidden danger right here is exactly why annual clinical assessments are non-negotiable. If you do happen to experience painful neuropathy, the ADA lays out some highly effective initial treatments with really clear direction on what doctors should prescribe and, importantly, what they need to avoid. So medications like SNRIs and gabapentinoids are strongly recommended to manage the pain effectively. But, and this is crucial, there's a huge red flag next to opioids for a reason. The ADA is very firm on this. The high risk of addiction, fractures, and overdose, combined with zero long-term benefit, means opioids literally have no place in treating diabetic nerve pain. Moving on to Section 4, foot care and preventing ulcers. Okay, we need to talk about LUPS, which stands for loss of protective sensation. This is the main villain when it comes to diabetic foot complications. If you develop LUPS, you literally can't feel a pebble in your shoe or a blister starting to form from tight shoes. And because you don't feel the pain, you don't stop walking on it. That tiny bit of friction can quickly spiral into a severe, non-healing ulcer.
To stop this perfect storm before it starts, the ADA mandates a comprehensive clinical foot exam. It follows 3 simple, totally painless steps. First, a visual inspection of the skin and foot structure. Second, testing for sensory loss using a 10-gram monofilament. I know that sounds super technical, but it's really just a tiny piece of nylon wire that feels like a gentle tickle. And third, checking your pedal pulses to make sure your blood flow is adequate. These quick tests catch the risk before a wound ever forms.
Now, while everyone needs this exam annually, the frequency really ramps up based on your medical history. If you have any evidence of sensory loss or you've had a prior ulcer, your feet need to be thoroughly inspected at literally every single medical visit.
Looking at the International Working Group's risk categories here, you can see exactly how the screening frequency scales up based on specific risk levels. It ranges from an annual checkup at level 0 all the way to every 1 to 3 months if you have a history of ulcers. It's all about highly customizing your preventative care so you stay safe.
And finally, Section 5, the Proactive Playbook. These guidelines really drive home a profound truth. While your doctor can prescribe incredible advanced therapies, like those anti-VEGF injections for your eyes we talked about, true prevention actually happens at home. Daily self-surveillance is absolutely your most powerful tool. Using a mirror to check the bottom of your feet every day, wearing proper footwear, and consistently optimizing your blood sugar, these are the daily plays that will help you win the long game. There's a quote from the ADA that completely captures the ethos of these 2025 guidelines. Early recognition of at-risk feet, pre-ulcerative lesions, and prompt treatment of ulcerations and other lower extremity complications can delay or prevent adverse outcomes. It entirely replaces the old fear-based narrative of diabetes with a message of proactive empowerment. So we've decoded these detailed guidelines, and I want to leave you with one final thought. What proactive step are you going to take today? Maybe it's calling to schedule that eye exam, or maybe it's just taking 2 minutes to check your feet tonight. You've got the playbook now. How will you take control of your health journey today?